All right, hey, it's Brad Perry with Kingwood Physical Therapy. I'm going to go into 4 stabilization exercises for a shoulder. And so we see lots of shoulder pain because of instability or multi-directional instability. You'll hear that term sometimes, but it's basically where the shoulder is just not staying where it needs to stay whenever it's rotating and going into flexion or some kind of movement of the shoulder, okay? So sometimes the shoulder, the humerus is going into this cavity here, and it'll get kind of moving a little around too much, okay? So we'll see these instability of the shoulder, and this will be kind of first phase, first set of exercises we sometimes give to those. So I want to go over these 4 to make sure we can stabilize that shoulder for you, but also not increase the pain. And so sometimes that's the trick. So sometimes we'll tell you, do these exercises within a pain-free range, okay? So the first exercise we're gonna do is called a wall push-up with a plus, okay? So go ahead and face the wall. All right, so you're in this position like you're gonna do a push-up, except for you're on the wall, and so it's not quite as intense as if you were doing a push-up on the ground, okay? And so what you do is go into kind of a push-up. There you go. And then as you push up, you're going to really arch this back here and flex this thoracic spine. And so that's getting those shoulder blades to move a little bit better and stabilize that shoulder. So it's a wall push-up with a plus. And the plus is arching that back right there. Good. Okay. So sometimes we'll tell you to do wall push-ups and maybe do 10 of them. And maybe I say do 2 or 3 sets of 10, and we'll do that 2 or 3 times a day, as long as it doesn't hurt, okay? The next exercise we're gonna do are what we call shoulder taps. So we're in the same position here, and he's gonna reach across with the opposite hand, there you go, and touch the shoulder, just like that, okay? So those are called shoulder taps, and I might say we might prescribe doing 10 on each side, okay? So 20 total, see how that feels, and maybe do 2 or 3 sets of 10 of those, okay? So those are called shoulder taps. The next one we're gonna do is called a shoulder hinge. So you're gonna put your forearms on the wall, okay? So we're in kind of this position, we're loaded the shoulder up a little bit, and then we're gonna rotate and open up this way, okay? Again, making sure this isn't causing pain on this shoulder or this shoulder, because we're going to do both sides, okay? Go ahead and close it, and then open up on the other side. Good. And then back. So those are called shoulder hinges, okay? So we're just trying to kind of hinge like a gate, basically. Open up the gate. So let's do it again. Open it up. Good. He's doing a good job keeping his shoulders here. You don't want to dive down too much. Also, you don't want to reach back too much and cause any kind of extra strain or pain, okay? So we're just trying to stabilize that shoulder and get the thoracic spine moving a little bit, okay? So those are called shoulder hinges, all right? The next one we're going to do are hand taps. So it's basically getting into a wall push-up position. Again, we're loading that shoulder up here. And now, might say reach across and tap the other hand. Just like that, and back. And so we can kind of start on the wall, and then we can progress to like on a table or a chair, and then all the way onto the floor. But this is the first step and first phase. And so then as those get easier, you're going to widen up the hands a little bit. And Steve's kind of already done that. Widen them up and touching, and we're really stabilizing that shoulder there. And then we might say, okay, let's do this a little bit faster if that's getting easier. So we're doing hand taps at a faster speed, okay? And basically we might say, hey, let's do 10 on each side, or touch each hand 10 times, and then let's do 2 or 3 sets of 10, and we'll do those 2 or 3 times a day, okay? As long as they don't increase your pain, all right? So those are the 4 exercises that we really start with whenever we want to increase stability of the shoulder without loading it too much and irritating it, all right? So thanks for tuning in.